Thank you all for joining us today. I am Kimberly Wickert from the University of Kentucky Human Development Institute in Retain, Kentucky. My preferred pronouns are she, her, hers, and I'm a mid-career white woman with blonde hair and glasses. I'm wearing a black sweater and have a virtual blue Retain background. I'll review a few housekeeping items before we get started today. Brandon Canada is our technical support behind the scenes. So thank you, Brandon. If you need any assistance, you can reach out to Brandon in the chat. The captioning feature is enabled, but you can disable it if you wish to do so. I will be monitoring the chat box throughout the presentation today. So please put any questions or comments there so you can join in our discussion. The information in this presentation or accompanying materials is intended for informational purposes only and does not necessarily reflect the views or opinions of the University of Kentucky Human Development Institute or its individual employees. Although we attempt to provide accessible, accurate, and current information, no guarantees are made to that effect. So mark your calendar for our next employment seminar series presentation on October 20th at noon, when I will review our Retain Kentucky employer resources to promote successful work outcomes using the return to work hierarchy. The registration is in the chat box for your convenience. And then the slide deck, as well as accompanying resources, will be sent out to everyone who attended today. So you will have that information as well. Today's objectives are to learn resources assisting an employer in the stay at work or return to work success, learn to promote recruitment and retention through Retain employer resources, and also to hear Retain support to implement those resources. So before we begin to look at our return to work checklist, I'm going to ask you to place your comments in the chat. What have you done to prepare when starting a new job, going back to work after being off for a period of time, or even a week of vacation, or if you're me, preparing on Sunday evenings for the upcoming work week? So if you don't mind, just take a minute and put that in the chat. I know I like to look at my calendar for the week and see what I have coming up. Oh, Elizabeth raised her hand. I'm wondering if, Brandon, can you check and see if the chat is enabled? It looks like people are raising their hands.
Yeah, it should be good to go now. Sorry about that, Kimberly. I don't know why it's defaulting to blocking.
No worries. For those of you who raised your hand, thank you for that. If you can put something in the chat now and let's see if it's working, that would be great. Give it a second here. Oh, we have something. Yay. Okay. Michelle said, review your calendar for the upcoming week. Thank you, Martha. You can you're in the chat. Review emails and calendar, Elizabeth said. So absolutely, those are all things that are helpful. Review schedule of week ahead, do research for new job tasks. Absolutely. So let's look at more ways we can prepare and also help others for their return to work. So we're going to begin looking at our Retain employment checklist today, and I will send this resource out to everybody who attended today, along with the slide deck. But most employers, as you can imagine, have a process for onboarding. But when it comes to returning to work following an illness or injury, there are items that we should consider to ensure that the employee has a smooth transition and is successful in their return to work processes as well. This list is not exclusive to employers, as it can be used by workers, their workforce professionals, to prepare them for the return to work. It is important to know what the worker can do specific to their work tasks So let's start with looking at what their current capacities are, because that's key to this process. For those of you who know me, you know that I focus on what people can do versus what they are limited to or restricted by. And we can ascertain the same information by using the term capacities, but it allows us to promote and support those workers proactively by highlighting what they can do versus what they cannot do. These capacities from a healthcare provider will allow the worker and employer to make an informed decision about the person's ability to work. If the employee is performing a position that is not their original position, providing written information about the transitional or temporary job or modified job description is also important, so the worker is fully informed and successful in their return to work. The worker, return to work coordinator, human resource person, as well as the direct supervisor should all receive this information well in advance of the return to work and include the work shift details as well as the start date of the return to work. Don't assume that the worker or employee may have their current capacities. I know when I was a case manager in a former work role, sometimes the employer in the workers' comp system would get updated return to work capacities, and they may even get them before the worker did directly from the healthcare provider. So make sure that the employee is in that loop as well. If the worker is new to the company during onboarding, oftentimes a welcome package with swag is a great option, but consider a welcome back option as well. Even an email, a phone call, or a text goes a long way to let someone know you are looking forward to seeing them back at work. As an employer, healthcare provider, or workforce professional, think about how you can support the worker, your patient, or client/consumer in the information and process listed here. Anybody have any thoughts about how you can do that with your clients, patients, consumers? How can you support them in that process when you know that they are going to return to work after being off due to an illness or an injury? I know I mentioned a few, making sure that they have their current capacities, making sure they know what it is that they're going to do when they return to work. So ensuring that the employer has communicated with them if they're returning to work in a modified duty capacity. So think about that. If you have additional thoughts, feel free to put those in the chat. If someone's returning to work, but working remotely, make sure that they know what those core hours are that they're expected to work. Otherwise, confirm the shift that they will be returning to. And make sure that they have the supervisor contact info if they're in a position that has changed, or maybe the supervisor has changed while they've been out. Make sure that you can encourage the supervisor to reach out to that employee to welcome them back to work and introduce themselves if they haven't worked together in the past. Elizabeth said if they work at a desk, stock or restock their basic supplies. That's a great idea. I love that. Michelle said if they have any items they may need for work, safety glasses, up to date on trainings. Absolutely. Those are all great ideas. So thank you both for that. And actually, that's a great lead into my next comment. If there have been any updates that have occurred while they have been out, ensure they receive a reorientation of sorts with those updates, including system changes or upgrades, company changes, clothing or uniforms, as well as safety equipment. I think, Michelle, you mentioned that, or personal protective equipment, maybe if they're in healthcare, should be reviewed, especially if the worker may not be able to wear a uniform or safety equipment due to their injury or illness. One example of this is an individual who I worked with who had a foot injury and could not wear closed-toed shoes during recovery. They were able to go back to work, but we really needed to consider that because it did impact their ability to work in certain positions because closed-toed or steel-toed shoes were required. The other thing to consider is transportation, if their ability to drive is impacted. So be sure to explore that to rule it out as a barrier to the return to work. Parking is also an important consideration. Consider assisting an employee with a parking placard that provides increased accessibility to their work location, or parking for employees who may need temporary access to closer parking to their workspace if they do not have a disability parking placard. So we're going to continue on, and you can see here some additional items that we need to consider when somebody is returning to work after being out for an illness or injury. So breaks may be part of an accommodation for a worker. So keep in mind not only scheduled breaks as part of a work shift, but if those breaks need to be altered based on the worker's needs or an accommodation request. If someone is starting work or returning to work after being out, having lunch with a coworker or a supervisor, or even having it purchased by the company as part of the swag goes a long way to let them know they are welcomed and feel as they belong or are part of the team. Confirm everything from an access aspect is ready for the worker when they return to work. So that they can be ready to go once they get to where they need to. That includes ID badges and system access. If there are resources that can support them in their return to work, remind them of what they are when they return to work and ensure the supervisor has communicated with them prior to their return. If someone's been covering their workload, that there's a transfer of projects or update of those project deliverables when they return if they need to pick up where the covering coworker left off. That'll really make a smooth, seamless transition for the person who's returning and really allow the person who's covering to hand that off and the project or whatever the task is to be very successful. I talked about changes to systems or technologies, and it's important to communicate that, but to communicate it a few days in advance so that they know to expect that. And if there's anything that can be done with your IT support or system support to test that before the worker shows up that first day to return, that's really helpful as well. As an employee, there's nothing more frustrating than being ready to work and system access not allowing you to do so. If there are policy changes, make this a part of the reorientation, as well as any announcements or organization changes. As a workforce professional, healthcare provider, or employer, encourage the worker to think about balancing their health appointments upon their return to work by scheduling those appointments ahead of time and outside of their work shift when and if possible, or requesting that time off if needed ahead of time. So just some things to think about that I think we can really help prepare our participants, consumers, clients, patients in that return to work process. So we've all worked along with the worker to get them through to recovery from their illness or injury. We want to make sure that they're extremely successful when they show up to work and eliminate any of those barriers or challenges that they may have that first day. So this section allows employers to customize to their own organization and add any items not already listed, as well as any notes for follow-up. So as I mentioned, I will send this out as a resource at Retain. We are always looking to modify and improve our resources based on what is going on in industries or in the workforce or in the healthcare field. So please, I welcome any feedback that you have as you look at it. If you're able to use it with your clients, employees, patients, consumers, please give me feedback. We really rely on you to help us continue to make sure that our tools and resources are speaking to and helping those who we all serve collectively. So with that, I am going to pivot and talk about another resource in the time that we have left. And I'd like to introduce you to the Disability Inclusion Profiler. This is an employer self-assessment tool that was developed by Dr. Fong Chan at the University of Wisconsin, along with his colleagues, that can be used to help organizations think about the disability practices they identify as most important, as well as where they are in the implementation of those practices. Dr. Chan has granted us special permission to use this tool as we see fit at Retain for clinical research and outreach. For individuals who are looking to work for an employer, they can review this tool to help identify what practices are most relevant to them as a worker, and then research how the potential employer has implemented those practices. I did put the link to this in the chat box, so feel free to check it out independently. And just a little more background on it. It is a 23-item disability inclusion profiler that was developed to identify characteristics and effective disability inclusion practices related to the employment of people with disabilities. It's also abbreviated as the DIP 23, and it's composed of 23 employer self-assessment questions and organized in 2 categories. Executive level and disability inclusion practices is 1 category, and then mid-level management and staff level practices. Each assessment question can be rated on a 4-point Likert importance rating scale, with 1 being not important, all the way up to 4 being very important. And then there's the 4-point Likert implementation scale, with 1 being not currently in implementation, all the way up to 4 being full implementation. Based on a combination of 2 rating scales, importance and implementation, the assessment results outline employer disability inclusion priorities and considerations. The findings and recommendations can be used to improve the inclusion of people with disabilities and in company inclusion and hiring practices. The assessment also compares employer results with companies of similar size if they would like to complete the online assessment. So as we go on and review the profiler here, we can see questions that consider how they assess the number of people with disabilities in their organization, as well as their diversity and inclusion policies. We look at executives and management with disabilities, as well as resources to support disability and employment and inclusion programs. Another way to assess diversity, equity, and inclusion practices through the Disability Inclusion Profiler is participation in job fairs for people with disabilities. And that's one of the questions that you can see here, as well as hiring of those individuals as part of employment goals and benchmarking and communicating those outcomes with interested parties, including employees. So we're going to move on and look at the additional areas that are covered, and other items to consider are internships, partnerships, contracts, accommodations, as well as a line item to budget for those accommodations. I also found it very timely for those of you that may be tracking Hurricane Ian. This question as far as communicating emergency preparedness policy or procedures with specific mention of persons with disabilities is very timely right now. So the last few questions that you can see here include disability inclusion and orientation. Do they include information on their website, social media, ADA compliance, strategic planning, and mentoring program? So I just am curious, for those of you who are seeing this, are there areas of this that are are new to you that you may not have thought of an employer including in their disability inclusion practices? Or are there areas that you feel are innovative that employers need to focus on more readily? So if you have thoughts on that, just take a minute and put those in the chat if you would, please. I know the one about emergency preparedness, again, very timely right now, because if you watch the news, we're all seeing about the hurricane down south, but that was something that I thought was very innovative in this process. I also thought how they were including it in a budget line item specifically for any of you who have had to look at budgets and profit and loss or P&L sheets. I thought that was pretty innovative too. Elizabeth said the mentoring program could be instrumental in building back an employee. Absolutely. That's a great point. Thank you, Elizabeth. So as I mentioned, I have included the link to the Disability Inclusion Profiler in the chat. Feel free to check it out. I went in and just as an individual answered questions based on previous work locations, and it sends you an email report back. But as an employer, you can also go in, and again, it can provide you information and compare you to other like-size employers. So I think it's a really good tool to look at where you feel like each number is important in your organization and where you're currently sitting within that organization. So for example, if you're looking at 19, include work and disability as a topic in the company's new employee orientation, and you feel like that's a 4, that's very important, but you're really only sitting at maybe a 2, maybe you just have, a very brief introduction to that in new employee orientation, but really haven't provided content specific to how work and disability is part of how your organization wants to focus and move forward, then that's a gap. And I think as an employer organization, that then tells you how, some things that you may want to work on in your strategic planning going forward. So we're going to go ahead and move on. And I just want to give you a quick review about Retain Kentucky eligibility and talk about how we can help individuals when they're returning to work after an illness or injury, as well as employers that may want to look at their inclusion practices in a more specific way using the disability inclusion profiler that we just looked at. So individuals must be a Kentucky resident, be currently employed or have worked in the last 12 months and have not applied for or are not receiving SSI or SSDI. And their injury or reason for their inability to work or stay at work must not be work-related. Ways that people can reach out to us to refer themselves, their patients, their consumers, or their employees is really any way that works for them. They can call us 859-562-3251. They can email us at retain@uky.edu. They can visit our website at kyretain.org. And this participant screener is also available on our website. And if they scan this QR code, it will ask them those eligibility questions that I covered a minute ago. And if they answer yes to those eligibility questions, it will take them to a queue where an intake coordinator will reach out to them within 1 business day 24 hours. So we're very timely in reaching out to individuals. When they reach out to us, we recognize that when somebody has a need to stay at work or to return to work, we need to be able to be there to support them in a timely manner. So we are able to do so. And as I mentioned, help them to prepare for those stay at work and return to work processes by assigning them to a return to work coordinator and collaborating to develop a return to work plan to help them outline steps to achieve those goals. And maybe some of those steps will be some of the considerations we talked about in our employment checklist to help them be prepared when they do get back to work. With that, I am going to look at the chat box. It looks like there is, don't see anything in the chat box, but again, I would invite you to review our employment checklist, specifically when you have someone who is returning to work after illness or injury. I welcome your feedback about anything that you see on there, and also check out the link to the website for the disability inclusion profiler. I think that's a really great way for employers to assess where they are and where they want to be. I think it's a great way for a worker who is looking to go to an employer to think about what's important to them in an employer's disability inclusion practices, and then check out the employer website to see, maybe how that employer may be comparing to what's important to them. I think as workforce professionals, we can use the employment checklist as a tool to help people return to work, but also the disability inclusion profiler to help them think about what's important to them in their stay at work or return to work. So again, I welcome your feedback on any of those once you receive them after today's presentation, and really appreciate everybody joining today. With that, I will say thank you, and I hope everybody has a great rest of your day.